long axis distraction, and that is a mobilization all by itself. Because when we do the other two modes, sometimes it's a little bit hard to get the distraction and to keep it, so we have to combine or separate them. So do some distraction first and then do a mobilization with oscillations. Okay? So the first thing we do is if we look at this orientation right here, how do we distract that joint? What do we?
You're going to have to come down.
Yeah, at an angle, right? Down like this and out this way, externally or laterally. Okay? So the long axis distraction is probably one of the easier ones to do. And that's just bringing them out into about 30 degrees or so of abduction like this. Bring them up into a slight bit of flexion like this. Control the limb here. I'm going to grab onto the lateral supracondylar and medial supracondylar ridge with my very cold hands. Yes. Okay, so here's what I'm going to do. In this way, if I do this, I can use my body weight as my distraction force like this. Okay? So I'm literally pulling it out and down like this, but I'm combining those two directions. So it's just like this. Okay, now, the problem with this is I have no idea mostly what I'm feeling. Right? So I can have her hold on to the table if we want to, like this, so she kind of counters my forces a little bit. The other thing is this, when I'm pulling out, is that mobilizing, is that actually distracting, or is that just taking up tissue slack?
Tissue slack.
Yeah, so I got to take all of that up and then lean back. And right there, I'm getting some distraction.
Does that feel good?
Does it feel bad?
Oh.
This is going to be your biggest problem right here, is your grip. Because that's usually uncomfortable for people. So you have to find a way to control this limb. You've got the whole thing going. One option is to come closer to the edge of the table, okay? Bend your knee and do this, okay? And you can feel probably a little bit more pull if I do that. Okay. So that's acceptable too. This is the way most people do it, and it's shown in the book. So it's not wrong. This has two advantages when we bend the knee. Number one, I'm taking out this feel too, right? And I'm just left with this. All I'm feeling is
probably less comfortable on their leg.
This is? Is
Yeah.
it?
I would think that other
On the
grip
upper
with
one,
fingers, yeah.
just on their upper leg.
Okay. And you can do this, or however you want to grip, that's fine. This is just comfortable for me. Okay.
And what is that? That's doing external rotation and...
She's externally rotated, slightly externally rotated, abducted and flexed.
Okay.
When we do that, we line it up to pull like this and just pull it out of the socket.
Okay.
Okay? So that's a long axis distraction. That's the most common way to get a distraction. So you can see how trying to combine that with something might be difficult. Maybe, maybe not. Okay? So that's the first one. Let's try that one just to get a